A big issue we see at this time of year is runners picking up colds. Unfortunately, in the UK, we spend our lives packed onto tube trains or in busy office environments with other people who perhaps don't live their lives as runners. So sure, it's miserable for them, but it's not quite the same as when you're training for perhaps a 10k, a half marathon, or maybe even a marathon goal in the spring. There are things you can do to help prevent those colds. We've talked in some of our other videos about ensuring you get adequate rest and giving you some of our top nutrition tips. Also thinking about things like hand sanitizer and making sure as much as you possibly can when you finish harder training sessions or hard runs that you're getting those kind of cold, damp clothes off quickly and getting yourself warm and perhaps even stretching indoors. But let's say, look, you feel like you've got a bit of a cold coming. If it's a head cold and it's not on your chest yet, you might think about not immediately stopping running, but maybe reducing some of the intensity. So if your training plan says to go out and do an interval training session or perhaps a threshold run or even a long run, perhaps reduce the length of that run, convert a threshold run to a short 30 to 40 minute easy run, and just give your body the space it needs to recover and preserve your immune system. If that cold is on your chest and you know the difference, you feel that your throat's kind of clogged up and blocked up, you're finding it hard to breathe, actually you're in a zone there where if you go out and train, it's both detrimental to your training because you won't recover adequately from that run, and actually you're potentially causing greater fatigue later down the line and missing sessions perhaps next week or the week after. But actually, crucially for us as running coaches, this actually becomes quite dangerous. We have seen runners in the past who have heart arrhythmias and issues that become quite serious because they don't listen to their bodies, and what feels to you like a pressure that you should go out and run, when you've got a chest cold, it's just not worth it. It's not going to help you, you won't adapt to the session, so listen to your body, back off, take a bit of extra time to rest, get to bed a little bit earlier, and use that time to really focus on healing and recovery to ensure that you hit your next session or next week's training much better.